Thank you. Thank you so much. And healthcare is personal. It's certainly personal for me. For those of you who don't know, I entered public service to work on healthcare policy. It was based on my own healthcare experience and my family's experiences. When I was 9 years old, I had a very serious illness, similar to spinal meningitis. It wasn't the exact diagnosis, but it put me in the hospital for 3 months. And after I fully recovered, my family couldn't find me health insurance at any price because I was labeled with those words, pre-existing health condition. And back then, insurance companies could simply refuse to insure somebody who was sick or had been sick. The Affordable Care Act, when we passed it, ended that type of discrimination. And of course, then we built upon its affordability in later years with the affordable premium tax credits. That brings us to today. In just 5 days, open enrollment begins for people who purchase their health insurance through the Affordable Care Act marketplace. Nearly 25 million Americans will see exactly how much more their health care will cost next year. Yesterday in Wisconsin, my constituents got a sneak peek. For an average family of 4, their premiums are skyrocketing by nearly $17,000. For an average 60-year-old couple, they will be paying more than $24,000 for health care next year. We found some folks, a 60-year-old couple in northwest Wisconsin making $85,000 a year, that will have to pay $33,000 more for their premiums next year. Yes, that's $33,000. And every one of these numbers has a face behind it, a story behind it. They all have to put their budgets together, figure out how the paycheck is going to last for the full month. Where are they supposed to get this type of money? Rent and food are a must. Do they sell the car? Do they take it out of their retirement account? What we know is that 4 million Americans will look at the price hike and say, it's too much, and I will go without health care. This is 100% avoidable, but my Republican colleagues are simply refusing to act. They've blocked us from giving families relief 10 separate times, but it is not too late to act. Come to the table and address the healthcare crisis and reopen the government. And President Trump, come back to the United States and address the crisis American families are staring down right now. And I'll end on this. I was recently asked about the political ramifications of this fight. Something along the lines of, will this help Democrats in 2026 on the ballot? I just want to say, to me, this is not about politics. This is personal for me. It is personal for the millions of Wisconsinites I represent here in the Senate and the millions of Americans who are staring down this health care cliff.
Thank you,